All right, let's start with the first organ of the alimentary tube, the alimentary canal, and that would be the mouth, which ingests the food. One of the major processes that occur in the mouth is mastication, what we commonly refer to as chewing. It is the mechanical breakdown of solid particles, and additionally, very importantly, it mixes those small pieces of food with saliva. In addition to that, our mouth is an organ of speech. It has also got a lot of sensory receptors in there, taste buds, and to help us with our food. It's surrounded by the lips, the cheek, the tongue, and the palate, and it will include both the oral cavity and the vestibule. So the cheeks form the lateral walls of the mouth, and they have muscles that are used for facial expression and for chewing. They have an inner lining of stratified squamous epithelium. Remember, it's stratified because there's a lot of friction going on. We're going to lose a lot of that top layer. So if we have multiple layers, we can replace the top layer as we lose it. The lips are highly mobile structures that surround the mouth opening. They have sensory receptors that judge things like temperature and texture of food. They are the boundary between the skin and the mucous membrane inside the mouth. The tongue itself is a thick muscular organ that occupies the floor of the mouth. It nearly fills the oral cavity when the mouth is closed. There's a structure called the linguinal frenulum that connects the tongue to the floor of the mouth. There are papillae, which are projections that move food and have taste buds on the surface of the tongue. And we also have linguinal tonsils that are a lymphatic tissue mass on the root of the tongue. The palate is going to form the roof of the oral cavity. It's got two parts, a hard anterior bony palate and a soft muscular posterior part. The uvula extends from the soft palate, hangs down in the back of the throat, back of the mouth. The palatine tonsils are lymphatic masses, on the sides of the tongue, whereas the pharyngeal tonsils, which are also referred to as the adenoids, are masses of lymphatic tissue in the posterior wall of the pharynx. Teeth are the hardest structures in the body. They are not made of bone. There are 20 primary or deciduous teeth. Those are the first teeth we get, and those are replaced by the permanent or secondary, and there are 32 secondary teeth. I'm not going to go into a lot of detail of how these are numbered. Most of us will never have to use it, but if you happen to work in a dental office, that you will get a handle on how to use this nomenclature. And you should be able to use your book and find the answers to homework questions regarding the nomenclature of teeth. A tooth itself is made up of a crown and a root. The crown is covered with enamel. The entire tooth is built in dentin, and within that dentin there is a cavity where the pulp is found. That pulp being the blood vessels, arteries, and veins, lymphatics, as well as nerves going through there. And the whole itself is referred to as the root canal. The tooth is held in place with a joint, gomphosis, and it is held with a periodontal ligament as well as a substance called cementum. Dental caries are cavities. They're in the enamel of a tooth. They form when sticky foods lodge between the teeth. They're in the crevices of a molar. Bacteria on the teeth metabolize the sugars that are there. They produce what is known as a biofilm, and there are acidic byproducts that will break down enamel and dentin. So we can help prevent cavities by brushing and flossing, regular dental exams, fluoride treatment, and the use of sealants. So we've got cheeks, lips, tongue, palate, teeth. That pretty much covers the mouth. I'll leave you to go through each of these individual locations and functions if you don't get them now. But again, refer to your book and make sure you use it to answer your questions, homework questions.